feel really passionately about digestion and the GI tract, and I find this area of nutrition and health in general really fascinating. So to me, this is sort of where I like to geek out a little bit and do learning and help our members work through some of those side effects. And it was really great to do version 1 of Potty Talk, which is how the name came to be, really looking at the lower GI tract, but we know digestion and cancer treatment and the effect it can has starts at the top. And I'm sure all of you are here because you have experienced some side effect, if not one, maybe many, maybe you still are dealing with some of these. So hopefully this will give you some tips to try, some things to think about, some strategies to use when eating and appetite and digestion are a particular challenge for you. So Potty Talk, impact of cancer treatment on appetite and eating. All right. So the agenda, similar to our version 1, we'll go over some daily reminders. So there are some commonalities when we're talking about each particular side effect to try to work through. So I pulled them out, and it's something that we can all sort of think about from a day-to-day. And then I also reviewed the usual suspects, meaning what are those medications that typically can cause some sort of upper GI impact on taste, on oral care, on digestion, appetite. And that list is pretty extensive, which I think speaks a lot to how frequent, how common this sort of thing is. We'll get into, again, those tips and tricks, side effect review. So we'll get into each little nitty gritty. At the end, we'll do some sharing because, again, what I have learned in my time with Unite for Her is that I and our team and our staff, we can always learn from you and we can learn from one another. And so this is a time where we would love to share, what have you tried? Hey, I was sort of experimenting with this, that, or the other thing. Let's share with one another because I think more information is always better. And then a few resources and points of support at the end, just some good places that I think are really user-friendly and provide really thoughtful information. All right, I pulled this from version 1 because I think this sort of reminder is important to mention now. So what causes appetite and eating obstacles for one person is not a guarantee that it's going to have the same effect on others. And I'd like to share this because many times in our consults and in our conversation, there's so much anticipation for how a person may respond based on their assumptions, what they think, what others have shared, what they've seen on social media. And sort of that anticipation can cause a lot of stress and anxiety as well. So I just like to say, going into a new treatment, if you're, if you've had a shift in treatment and you're starting a new medication, or maybe you're at the beginning of your treatment journey, just give yourself grace and take it one at a time. Nothing is ever a guarantee, but again, like our team is here to help you manage through these side effects. I love this slide because, again, I think it really speaks to how chemotherapy specifically has an effect on the whole body from top to bottom. So we'll be focusing, on mouth sores, nausea, vomiting, some of the digestive distress, upper digestive distress. So we'll be honing in, but the impact that treatment and medication has really can be felt from head to toe. It really just is quite a significant regimen. So everyday reminders, when we are thinking of upper GI and doing what we can on a consistent daily basis to really support good oral health, good digestion, there's a few things, again, that sort of showed up quite a bit through each of the, all of the information that I gathered. So number one, when we're thinking of the mouth and digestion and upper GI, practice good oral hygiene. So keeping your mouth clean, regular dental work, or just, brushing your teeth, seeing the dentist regularly, making sure that your dentist knows what medications you're on and chemotherapies that you're being treated with. There's so much overlap between overall health, heart health, and our oral health that practicing good oral hygiene is really important. Using a cleansing rinse daily. And on my next slide, I do have a recipe. Many of you know it. salt, baking soda mixture with some warm water. It's safe for everyone. It helps to just keep your mouth clean. It's non-irritating, so it's something that we can all do. And with that being said, avoiding mouthwashes with alcohol. They can be burning. So as much as, we may love that Listerine sort of burn feel, when you have sensitivity to your oral cavity, your esophagus, throat, using something without alcohol is really important. We're not trying to create additional inflammation. And then I love this sort of mindset reminder, and this can be really helpful when eating and nutrition is just particularly challenging. Approach eating as part of treatment, right? So shift that mindset of, this is what I can do to be a part of my treatment plan. It's an empowering frame of thought. So just sort of keeping that in mind, approach eating as a part of treatment, hopefully can give food and nutrition and sort of those strategies that you try a different perspective. So cleansing, rinse, and I was telling Sue earlier when I was putting together this slide, I kind of wanted it to be like screenshotable. Of course, you'll get all of these slides, but I wanted it to be, if there was particular tips that really spoke to you, it was like, oh, let me take a screenshot of that and refer back to it later. So this is a really great cleansing rinse that, again, we can all use. Frankly, whether or not you have oral irritation or not, this is something that's good for all of us. So 3 to 4 times daily, or as directed by your physician. So if they want you to do more or less, follow those instructions, but generally speaking, 3 to 4 times daily. With every 4 cups, I like, of warm water, 3/4 teaspoon salt, 1 teaspoon baking soda, and just use that rinse throughout your day. So after you eat, after you brush, it's like I said, there's no risk of interaction. It's not going to be irritating. It's something that just helps promote good, clean oral hygiene. All right, the usual suspects. And again, you look at these bullets and so many of these medications are familiar to us. And it's not that we need to go through all of these, but I think the point is that a lot of treatments, a lot of medications, a lot of long-term therapies, things like aromatase inhibitors, can have an impact on the oral cavity. I was reading a research study recently that said as much as 75% of cancer patients have experienced some sort of impact on their appetite, digestion, their oral health. 75%. So that's a huge number. So there's lots of reasons why a person's eating and appetite can be affected. All right, so what will we be covering this evening? So there's a lot. I'll be cruising through to try to stay on time, but there's a lot to cover because there's a lot of things that can be impacted. So I tried to do the most common: nausea, vomiting, changes in taste and smell, inflammation of the mouth and esophagus. So early satiety, getting full earlier, anorexia, so decreased appetite and intake. Oral candidiasis, so for you have any sort of yeast infection, thrush in your mouth, and xerostomia, dry mouth. So I'll be covering all of those and providing some tips on how you can maximize your nutrition for each one. So first, let's start with what I think is the most common. What we hear a lot is nausea, vomiting. And so essentially, it is stomach upset. It can include vomiting. It could just be nausea. There's a lot of different types that a person could experience. So, and I think that it's worth calling out each of these because as you communicate with your medical team, as you're talking with your nurse navigators, it's really important to kind of share timing around some of these side effects. So anticipatory, it's sort of that feeling of nausea, vomiting before you even get into treatment. Maybe you've had some experiences, and so you're starting to anticipate not feeling well. But then we've got acute nausea, vomiting. This happens within 24 hours post-treatment. So if you have treatment and shortly thereafter, that is what we call acute, versus delayed, which is nausea, vomiting that happens 1 to 7 days post-treatment. So if you're noticing that you feel fine for a few days, but you're not starting to feel those side effects, until further down the line. That's what we call delayed. Let your physician know that. Breakthrough nausea vomiting is the side effect that you get despite trying medications to ease some of them. So if you are using things like Compazine or Zofran and it's helping, but you're getting some breakthrough, that is what we would call that. And then refractory is when nothing works. This is a really severe case. You know, there is no medication, there is no anything that helps these side effects. So if this is something that speaks to you, or if you are on a regimen where, you know, it becomes a little bit more cyclic and there's a few days where you're not feeling well, this kind of helps you identify with a little bit more certain as you communicate to your team. And the degree at which a person can experience nausea vomiting can really vary. So what we're seeing down below, loss of appetite, maybe you just have a little bit of a decreased appetite, but your eating habits, you know, really haven't changed that much. Maybe you're a little less hungry, you eat maybe a little less, but for the most part, things are pretty much at baseline. Moving forward, you could have decreased intake with or without weight loss. We're sort of in a moderate sort of side effect range, and that can lead to really severe decreased intake, unintentional weight loss. So a lot of significant side effects can come down the line. And that's really what we want to prevent. We want to sort of stay ahead and use techniques that can help you manage so that you don't get to that severe point. So some do's and don'ts for how to work through nausea, vomiting. And this is where some of that screenshotting, I think, can be really helpful. So some of these you may know, hopefully a lot of these, but if not, maybe you're picking up one or two things to try to see what works for you. So do's, small, frequent attempts at meals and snacks. So let go of the expectation that you need to sit down and have a full meal. Set that aside. Most often, what is better tolerated is having smaller portions, even just a few forkfuls, a few spoonfuls, smaller bits more frequently, a little bit at a time. Reaching for those bland, starchy foods, right? We know the brat diet. There's a reason why it's out there. It really can help soothe the belly and sort of calm things down. So bland, starchy foods. Clear liquids, you know, hydration is a big part of it. That can also be particularly challenging. Keep them at room temperature. So pretty even, not too hot, not too cold, especially that hot temperature. So I talked about that in the don'ts, but with nausea, as I'm sure many of you have experienced, aromas and smells are particularly triggering. So our sense of smell is often very heightened, and keeping things at room temperature or even cooler reduces the aroma of things. And that goes for even liquids as well. In an effort not to fill your belly as you're eating, consume your liquids with your meals separately, right? So if you're sitting down to have a few bites, but you've just taken a big drink of something, that could potentially fill your belly, in which case we want to maximize that space for something solid, nutritious, nourishing, right? So just hold off on having any beverages until after you're sitting down to have your small meal or snack. Keep your head elevated 30 to 45 minutes after meals. This is for reflux. So sometimes nausea can be aggravated by reflux, and eating and laying down is something that can definitely trigger reflux. So we want to keep that to a minimum. So we minimize the risk of nausea. So keeping your head elevated helps with just natural digestion. Really interesting strategy points. Time meals for when nausea meds work the best. So if you are using something like a Zofran, a Compazine, and you know that you typically feel better for the next few hours, use that to your advantage and take that time to plan out having a meal, having a snack, leverage that time. And then take pain meds with crackers or light food. So pain meds can notoriously cause some GI upset. So just having something dry and bland with it versus on an empty stomach is a good choice. And then avoiding greasy, high-fat foods, highly seasoned foods. So things that are in high fat, greasy, heavy foods tend to sit in the belly longer. They take longer to digest. And when you have food that's heavy that sits in the belly, that will make you nauseous. So again, think light, think small. Limit exposure to cooking odors, okay? So again, we're thinking of those smells and that the sense of smell that's way, way, way more heightened during this time. So stay away from food prep areas, making sure that if there is someone cooking, they're using an exhaust fan or opening a window so that some of those aromas can go. So really being thoughtful with how to sort of steer clear of that sort of thing. And then any other particularly strong smells, perfumes, candles, air fresheners, plug-ins, anything like that, that again can sort of trigger that side effect. Just be mindful of that. And then I thought it was worth, for nausea and vomiting particularly, and many of us know because a lot of these we talk about with our Unite for Her wellness program, other therapies can be really, really helpful in reducing nausea. Ginger tea, ginger ale, made with real ginger can be soothing. Things like acupressure bracelets and certain points on the body that can ease nausea. We know acupuncture can be very helpful for that. Even gentle massage, some relaxation techniques. I know Sue has talked often about how yoga and the power of breath has been helpful when she was feeling nauseous. So that can be really helpful. And then even some self-hypnosis. So, that just sort of working through and learning some of those techniques. So not only from a nutrition standpoint, but really looking at these other complementary methods, I thought it was worth mentioning these as well, just as a little reminder that there's lots of tools you can lean into. Okay, moving on, changes in taste and smell. So this is tough. And this also can show up in different ways. So a person could have a change in their sense of taste, meaning it tastes differently, things taste off, they have little, they're bitter, they're salty, they're too sweet. So it could show up in that our sense of taste or smell is misplaced. It could also just be an overall reduction. Food doesn't have any taste, or I can't smell anything, or an absolute absence of it. So know that a person could experience changes in taste and smell in a variety of ways. So let's talk about how you can work through some of these. So if you are experiencing that your food just tastes off, here are some things that you can do. So opt for foods with fruit and salty flavors. So fruity, salty flavors. They tend, when food tastes off, those flavor profiles tend to taste the best. Use marinades to change or add flavor. So using things like herbs and spices or things that have stronger flavors. I mentioned that in the third bullet: herbs, spices, lemon, vinegars, pickles, things that have a stronger flavor. Use that to your advantage to improve general flavor. And then be mindful of things that are spicy, things like hot sauce. While it may feel like, oh, that might be a good addition to add it, it really may not make much of a difference, because spicy or hot foods is actually a sensation. It doesn't really have much to do with the flavor. Those condiments definitely have flavors to them. But when we're thinking of heat, that's a sensation in the mouth. So it may not make a difference if things just taste off to you. And then moving on, if you are experiencing bitter, acidic, metallic taste of your food, eating, again, that sweet component can complement foods or meals. So think about having sweeter fruits alongside your snacks or as a snack or with your lunch. That flavor profile can sort of, to a certain degree, complement or help some of those bitter acidic flavors. Sweet or sour, drink sweet or sour beverages. So again, sort of leaning into that flavor profile that can offset some of the bitter, acidic, metallic taste. Use strongly flavored spices, seasonings. Think onion, think garlic, think chili. Again, that can offset some of that bitter, acidic flavors. Improving the overall taste in your mouth. You can use things like lemon drops, gum, or mints to improve that taste. And then choosing alternate sources of protein. So typically things like red meat or beef or high iron foods, your palate is so sensitive that that is what it will pick up on, giving that sort of metallic, acidic taste. Whereas if you choose things like eggs or tofu or dairy, nuts, seeds, beans, you don't tend to get that same flavor profile. So think about incorporating those foods to sort of minimize how much you're experiencing that. And then finally, this is really, really a simple thing that any person can do, is moving away from metal silverware, reducing that sense of metal in your mouth, and going with bamboo or plastic silverware or chopsticks as a means of eating. So really just holding off from putting any sort of metal in your mouth to begin with. Salty and sweet, right? We absolutely know that these flavor profiles can be quite pronounced depending on a person's treatment. So starting with salty, the obvious, choose foods that are a little bit more naturally sweet. Because remember, your palate is very, very sensitive. So even that little bit of saltiness, you're really going to pick up on. Boiling your food can help to reduce some of that salty flavor. So if that is a method of preparation that may work for whatever you're preparing or whatever, you know, your support person is preparing, think about boiling it. That can help reduce that. And then also using low or no added sodium products in your recipes. You know, I think this is a pretty obvious thought, but we don't want to try to add to that salty flavor by using ingredients that tend to be high in sodium. Versus the opposite. So what if you're having an enhanced sweet taste that is really pronounced in your mouth? You want to go to that other end of the spectrum, choosing bland or sour foods, right? Even if you're having some juice, dilute it. Or if you're using a little bit of something like a cherry or pomegranate to flavor your water to get some hydration in, use less. Or serve those beverages over ice and let it dilute a little bit to really reduce that flavor profile. And then again, choosing veggies instead of fruit, because just fruit is naturally sweet. And so you're really going to pick up, it can be too much. So choosing vegetables instead can be a good alternative. Smells. So sensitivity to smells can really disrupt a person's appetite in general. It can be really, really problematic. And typically, sensitivity to smells often comes accompanied with some of these other side effects as well. And I mention that especially when we're talking about nausea, vomiting. Smells are a huge, huge trigger. So if for you, you're noticing that smells in general are, or certain smells are off-putting, again, we're going to talk about temperature. So hot foods, warm foods tend to be more aromatic. So cool them down or reach for foods that are either just naturally enjoyed cold or at room temperature. And then avoiding foods with strong odors to begin with. So anything that has really pungent flavors or ingredients or spices as part of them, hold off on having them as well. Again, avoid cooking areas during meal prep, ventilating the kitchen or the cooking area so that the exhaust fan or an open window can help to get some of the aromas out of the kitchen if it's something that could turn your stomach. And then avoiding lengthy cooking processes. Think slow cooker, think crock pot, right? So if you were not sensitive to smells, you know, I love a good weekend crock pot dish. It makes my whole house smell good. Well, if you are really sensitive to smells, that can be quite troublesome. So sticking with quick, convenient, easy methods of food preparation to limit how much those smells can sort of linger to other parts of the house. Okay, moving on, early satiety. loss of appetite, or anorexia, sometimes as we would call it for someone that, really has just a decreased intake in general. But essentially, we're looking at, it's defined as a loss of appetite, right? So early satiety, getting full, loss of appetite. And again, there's varying stages, as with all of this. So you could have a decreased appetite, slightly decreased, but it's not really affecting you as much. You're still, you're making sure you have a little breakfast, little lunch, dinner, hydration. So the effect is not that great, versus progressing to a really significant situation where there is unintentional weight loss, consistent weight loss. This becomes problematic. And we know if that is a situation where a person is noticing that their weight is consistently decreasing unintentionally, it puts that person at an increased risk for things like an infection or illness, not being able to tolerate treatment or having to pause their treatment. They could recover from procedures or treatments slower, not as well. So it really is important to make sure that we understand that this can happen, but how can we best manage it to minimize the side effects? So what can you do to improve your appetite? So again, sort of going back to that sort of nausea topic, small, frequent, right? We want to make the most of what you're eating at the time. So even if it's a couple forkfuls, spoonfuls, a small portion, small, frequent meals tend to be better tolerated. Also, again, letting go of that expectation of having to sit down with a full plate of food, especially when the appetite really isn't there. That when we start to anticipate having to sit down with a lot of food, it's very overwhelming and it can be stressful for someone. So if we just say, all right, I'm going to have just a little dish of, or a couple spoonfuls of, and that is what our goal is for that given time, that is much more approachable. It's not so overwhelming. But nutrient-dense foods are really important piece of this bullet. Because again, we want to make the most of what you are eating. So we want to make sure that there is some protein with it. There are some healthy calories, if we can get some fiber in as well. So we want it to have some degree of nourishment. Schedule meals and maximize your intake when your appetite is best. So a lot of times, we may feel like, all right, well, I'll just eat when I feel hungry. When I start to feel hungry and I feel like I want something, I will eat. And for some of us, that may work out just fine. But when you have little to no appetite, a person can go quite a while without feeling hungry and having that hunger cue. So the best thing to do is, just like you would schedule meetings or your appointments, schedule in some time to have a little snack, to have a little lunch, versus relying on your own cues because they are reduced. And so building in that regimen can also help to not only better meet nutrient needs and things like hydration and protein intake, but it can also help, that regimen can help to improve your overall appetite as well. So think about scheduling a little time. And again, it doesn't have to be a big portion of food, but even if it's a handful of something, just designate that little bit of time for you to get in some sort of nutrition. And then if needed, you can rely on supplements, nutritional supplements. There's a lot out there commercially. I know what's out there. I've worked in a hospital. There are some better brands and nutritional shakes that we can find at the store. Our dietitians also have a plethora of smoothie recipes that you can make at home, that you can squeeze in a lot of nutrition, fiber, healthy fats, protein. And even if you just have 3 to 4 ounces or just a little half a cup at a time, again, you're sort of maximizing what you're having, and it can be a great way to get in nutrition. And typically when there's not much of an appetite, liquids can be better tolerated than solid foods. So even just sipping a little bit on it, stick it back in the fridge, come back in an hour or two, have a little bit more back into the fridge. But that can be a really great addition to other little bits that you're reaching for. Again, liquids between meals. So not taking up valuable space in your belly for liquids, but holding off and having your water or beverage or tea or whatever you're sipping on outside of mealtime. Okay. So we want to maximize that space. We don't want you to get full on a liquid. Leaning into easy to prepare and serve foods. So with a decreased appetite, fatigue and energy are likely going to be low as well. And we want to preserve your very valuable energy. So that means not spending too much time in the kitchen and using a lot of energy to move and cut and prepare, but really leaning into healthy convenience. And also keep convenience foods on hand. I always say, listen, again, we're not sort of relying on your own appetite. Leave things out so you have a visual reminder, a visual cue to take a handful of this, take a handful of that. I walk into the kitchen, I'm looking around, I kind of fancy something, but I'm not really sure. Oh, you know what? I have a little bowl of something in front of me, I can grab a handful. So just leaving things out and in visual sight can be enough of a trigger. The mindset. So again, going back to that mindset that I mentioned early on, shift how you see nutrition and appetite. See it as a part of overall treatment. This is the part that you are playing in your overall health. And maybe that shift in how you view it will be not so much of a burden, but more empowering, like, okay, this is my role. This is what I can do. Let me do the best that I can do to really nourish yourself. We're not striving for perfection as with anything, but shifting that mindset a lot of times can do wonders for us when something like nutrition and appetite and eating can just be a really overwhelming feeling and, activity. And then light physical activity. So movement in general can really help to improve appetite. So gentle walking, some stretching, some chair yoga. If you are able to continue doing some sort of activity, yoga, light strength training, going to a gym, whatever feels good to you, whatever has been part of your routine. If this is something that you are bringing back into your routine, it can start with 5 minutes. Walk out to the mailbox and walk back. Can you do that twice a day? Can we extend that? Can we do some videos from her library with some chair yoga or gentle stretching or body weight movement, right? So light physical activity can be really, really positively impactful.
Erin, I'm going to ask you a question real quick. That's okay?
Sure. Sorry about that. I was, sorry, clear my throat. Go ahead.
That's all right. We always hear nutrient dense foods, and For Her has such a philosophy about nutrient dense foods. It is something that we talk about often.
Yeah.
And there's a lot to choose from. So one of the questions in the chat was, give me a couple examples of nutrient dense foods.
Oh, I love that. So great example would be, we'll do a compare and contrast. So maybe I want something really bland and all I have is a little bit of white bread in the pantry. Okay. We could upgrade that and make that a little bit more nutrient dense by maybe getting a whole wheat version of bread. We're getting a little bit more fiber, getting a little bit more, if it's a seedy bread, we're getting a little bit more protein with it as well. Or using things that are good sources of like healthy fats. So incorporating things like a nut or a seed butter. Other foods, things like incorporating yogurt that has healthy probiotics and some protein. So think of it as choosing foods that bring nutrition to the table, so to speak. Add a little bit of protein, add a little bit of healthy carbohydrates for energy, healthy fats for your heart and satiation and good energy, versus something that doesn't really bring much nutrition to the table. It could be things that are more refined, things that might be in like sweetened beverages, that again, like they don't really offer anything to the table. So hopefully that provides a little bit of insight. That's how I tend to think of nutrition dense foods. What's it bringing to the table? Am I getting vitamins and minerals? Am I getting something that's going to aid in my overall health and well-being? Or is it something that isn't really bringing much? And if I can only have a little bit, how can I maximize what I'm eating? Does that make sense?
Yeah. Yeah. I think it's, even getting rid of your package, like thinking packaged food most likely is not going to be nutrient dense, right? Processed food is not going to be nutrient dense.
Highly processed foods, highly refined foods are not going to be those nutrient dense choices at the end of the day. So, and it can look like, it doesn't mean that, you have to throw together this big, beautiful stir fry with all these different veggies and all these different things. Nutrient dense can be these subtle upgrades, right? We talk about these upgrades. So even things like if you're having some bread, I love a good piece of bread with some butter on it, but maybe I'm using a little bit of almond butter instead, where I get some healthy fat, some more healthy calories to help my overall energy. So these subtle shifts that we can make that bring us more nutrition.
Yeah. Sprinkle a little pumpkin seeds on that.
Absolutely. Yes.
Add a little
Agreed.
honey if it's going
100%.
to allow your palate to get some sweet, right? Add a little honey or
Yes.
maple syrup. Don't be
Yes.
afraid of doing that, but that all just
Yep.
adds to that nutrient dense food. Thank you, Erin.
Yeah. So yeah, absolutely. I love that question. I love that question. Okay, so moving on to what can be really problematic with just the function of eating in general: mucositis, esophagitis, inflammation of the mouth, inflammation of the esophagus. Anytime you see itis, it essentially is inflammation. So that could show up like mouth sores in your cheeks, the front of your lips, on your tongue, around, along your gums. They can show up anywhere, and they can be wildly painful, and they can make eating painful, drinking painful, literally everything. So they can be particularly troubling. An irritated throat or a sore throat or the feeling of a lump in your throat can all be from having some degree of inflammation. And again, there are varying stages of severity when we're dealing with this. So you may have a little bit of sensitivity on your tongue or a little bit of sensitivity on the cheeks of your mouth or irritation, but it doesn't affect too much. Maybe you're not having anything really hard or crunchy, but for the most part, you're doing okay. Versus really significant oral pain or throat pain, where it makes swallowing difficult, the texture of food is difficult, and again, it can lead to requiring some other intervention if you're not able to meet your nutritional needs orally. So again, we want to try to minimize a person's risk for that. So do's and don'ts. So we'll start with some do's. Do choose low acid foods, right? So we have inflammation, and I'm sure that this is obvious for most of us, but low acid foods, because things like citrus, when you have irritation, will absolutely make it worse. So choosing those low acid foods, as well as soft foods. So things that may have a rigid edge or be particularly crunchy, or could potentially sort of scratch your tongue or irritate your gums or the side of your mouth. We want to avoid those when it's particularly troublesome. So choose soft foods. Prepare your smoothies, right? So again, like beverages and drinking, cold beverages could be soothing for an individual, but be mindful of the produce that you're using. Anything that's too high in citrus or acid, we want to hold off on incorporating those as ingredients. Using sauces, gravies, soups, and broths to moisten food so that it's easier to chew, it's easier to swallow. So we're really looking at a soft, non-dry, sort of well-saturated texture of our food. And then again, serving foods at cold or room temperatures, because too extreme of temperatures, especially too hot or too cold, especially that too hot, again, can be an aggravator, right? So if you've ever like burnt your tongue and you have something hot after that, it hurts. It's very uncomfortable. So think about keeping a moderate temperature of your food and beverages. And then avoiding strong seasonings and spices. So anything really pungent, strong, spicy foods, again, think irritation. So if your mouth or your throat is irritated, they can be a trigger. Limit carbonated beverages. And I have heard this from a number of our members as well. Carbonation irritates the mouth when you have some sensitivity. So choose things that are non-carbonated or let your beverages go flat if that is something that you are consuming. Avoiding tomato products, citrus, pickled foods, things that have acids, vinegars, that sort of thing. Now, there's some other really interesting things to consider when we're looking at irritation of the mouth and the throat. There's other things that can help. So number one, avoiding alcohol and tobacco use. This sort of goes back to when you have that much of your oral cavity affected, we want to really do what we can to maintain good oral hygiene. And so alcohol can be an irritant. Tobacco use, uncleanly, increased risk of infection and introducing things. So really, you want to, consider not imbibing in those activities. For dryness, using a lip balm, keeping your mouth, you can get some irritation on the sides of your mouth or around your lips. So making sure that they are well moistened so we're not cracking, we're not irritating. So find that healing salve that came in your care box. That stuff is amazing. I take it with me everywhere and I use it as a lip balm. So very, very helpful. Find one that you like. Again, avoiding alcohol containing mouthwashes, right? So that alcohol can be irritating. So hold off on that altogether. That cleansing rinse would be perfectly safe. So you could mix that up and use that to keep your mouth clean. There are some topical gels and rinses that you can speak with your physician about, or things that you can apply to, think canka, that can help to numb some of the sores or areas, especially around eating time. So if that is a challenge for you, think about how you can strategize when you use them so you can make eating and drinking a little bit less unpleasant. And then there's a couple other things that came up. So L-glutamine is an amino acid, and there are some studies that have shown that taking L-glutamine as an oral supplement, it's typically found in a powder, can help reducing mucositis, so oral inflammation during chemo. So this particular amino acid is depleted in high stress situations. So think major surgery, a situation of sepsis, having cancer, going through treatment. That amino acid is often depleted, and it plays an important role in the intestinal lining of our GI tract. So there are some good studies that have looked at having L-glutamine as a supplement. The dose that is often recommended is 15 grams, consuming it 15 grams twice a day for 7 days after chemo infusion. It's definitely something that you want to speak to your physician about, or the oncology dietitian that you're working with if you're feeling particularly inflamed, if that is something that is appropriate for you. It is contraindicated if anyone is taking lactulose, so often used if in a liver situation or for constipation. So you do not want to take it if you're using lactulose or if you're taking any anti-seizure medications. So it's not something that you want to just start willy-nilly, but definitely speaking with your physician at your oncology center if that's appropriate. And then cryotherapy, some of you may have experienced this. So using cold therapy during certain chemo infusions. So typically, and I have seen this with patients getting 5-FU and any sort of high dose IV chemo or some sort of high dose IV chemos. So the thought is using cold therapy, meaning having sucking on ice cubes, drinking cold beverages, the constriction, so the constriction of your blood vessels reduces the amount of blood flow to those areas, which means the chemo agents are getting to those areas less, reducing risk of inflaming those areas. So for particular medications that are known to cause oral irritation and esophageal irritation, you also may want to talk about with your nurse navigators or nurse team about using cryotherapy if that's appropriate, if they feel like it may work to reduce some of that oral irritation. And then quickly moving through the last couple, little less, I know we have a few minutes left, but I do think it's worth noting. So candidiasis, so thrush, yeast infection. We typically see this in those that are immunocompromised. So severe immunocompromised patients can have an overgrowth of yeast, and it typically presents in like a really irritated oral cavity. You can see white patches on your mouth or in your tongue. So again, practicing good oral hygiene, really, really important, using saltwater rinses, avoiding those mouthwashes with alcohol, making sure to replace, sanitize your toothbrushes. If you use a tongue scraper, any of those sort of oral things, your dentures, making sure they're either replacing or cleaning them really well. Being mindful of things that can irritate that sensitive area. So again, soft textured, low acid foods and beverages, that carbonation I mentioned can be particularly irritating. And then active culture yogurt. So in an effort to reestablish bacterial balance, making part of your day live active cultures, like in the form of yogurt, is generally safe in this population. I would advise against doing an oral probiotic because typically, as I mentioned in the beginning, this sort of situation happens in those that are immunocompromised, and introducing high dose bacteria in a person that may be neutropenic or severely immunocompromised, we don't want to increase a person's risk for something like a bacteremia, but consuming it naturally is perfectly safe. So that is a little tip that a person could add into their day. And then dry mouth. So again, this can be really problematic, also called xerostomia, but you don't need to know that. So dry mouth can lead to a lot of things if it is not appropriately addressed. So overall oral intake, right? If you can't chew or let alone swallow anything down, it makes eating miserable. And so it can lead to just overall reduction in intake, which can trickle down and lead to nutrient insufficiency, so not getting enough nutrients in, and long-term deficiency, right? So you want to make sure if this is something that you are struggling with, you're talking to your medical team about it. Dental decay. So that dryness, there's a reason why we want to keep our mouth hydrated and moist. That helps with, keeping our teeth healthy and our gums healthy. If not, it can lead to some decay. Obviously, some taste changes, things taste off, avoidance of certain dry foods. So a person may start to recognize foods that are particularly challenging to chew and swallow, avoiding them. That list can grow to be very long. And so when we start to really reduce our food choices, again, we're going back to that second bullet, leading to some nutrient deficiencies. And then again, overall weight loss. And we want to make sure that a person is maintaining a healthy weight. So what can you do about it? So if you have dry mouth, some tips and tricks. Small frequent meals. Remember those little bits versus having a big mouthful, a lot of food in your mouth, but little bits are the way to go. Alternating, so this is where we're going to use foods and liquids together, alternating between bites and sips. So you're using that sip to moisten the mouth. We're adding things like broths, gravies. We want to make sure that the food is not dry, that it is well moistened, it's tender, so it's easier to chew. You want to make sure that you're staying hydrated, right, from the inside out. So sipping liquids throughout the day, investing in a good water bottle to keep with you is really important. It doesn't allow your mouth to get too dry. And a little trick, so a swish and spit, I should say, with some club soda, carbonated water can help to instigate some of the oral secretions. And then thinking like big picture, making sure your home, especially this time of year when our heaters may start to be on, or we might be using the fireplace, it will dry out the air. So finding a way to add moisture back into the air with a humidifier. Again, maintaining good oral hygiene, using things like hard candy or frozen grapes that you can suck on that can help to moisten the mouth. Again, staying away from mouth rinses with alcohol and those alcoholic beverages and tobacco. So going back to that good oral hygiene. So I sound like a broken record, but I do think that these are some good reminders that we can all think of as we're sort of doing what we can to really support our overall upper digestion. Good oral hygiene, using that cleansing rinse every day, avoiding those mouthwashes, and then that mindset approach of this is my role that I can play. How can I be an active part of my treatment, and seeing nutrition and these little strategies as your part of your overall treatment. So this is where, and I can stop share. Actually, I'm not going to stop sharing because we can get into it. I know we're at the end, but hopefully there's some things to share. But there's also a few good resources that I love, and we'll have the PDF on our Her library. But cancer.net has great, and this is all hyperlinked. You'll get all these links. They've got some great resources on upper GI side effects and managing through it. Cancer.gov has a whole booklet called Eating Hints that I think is really user-friendly, really great for consumers. And it is pretty thorough and sort of takes you through all of these various side effects and what you can do. The American Cancer Society also has great resources. But most excitingly, what our team has been working on is a Unite for Her side effect guide. So we are taking all of these different upper GI, lower GI, vitamin nutrition deficiencies, and we have been working together to put all of these together in one guide for you. So that will be coming out in the next couple months. Our team has been working together. We're also going to have a version in Spanish for our Hispanic community. So know that we want to make a one-stop shop for all of this information for you. So not available yet, but coming to you soon. So with that being said, let me stop sharing. If anyone has any questions or wants to share sort of what they have found works for them in terms of addressing any sort of these upper GI side effects. Oh, you're so welcome. I hope this was,
yeah.
Oh my gosh.
Chat.
It's
just clarifying,
so much information
15
to hover.
grams. Wanted to make sure we're quantifying that and qualifying
Twice
that
per day.
Yep.
15 grams. Yep. So 15 grams, and typically in a powder, it will tell you the serving and how many grams of that L-glutamine will be. So it might say, a teaspoon or a tablespoon is 5 grams or something. So you know how much you may need in a liquid. Again, as with anything, always talk to your physician, your clinical dietitian, before starting any of that, especially if you're on any of those medications or that are contraindications for it. So I would always recommend speaking to your team first, but that can certainly be something worth trying.
Yeah. I know too, that Cancer Fighting Kitchen cookbook, Erin, I believe it's in there as well. So many good nutrient dense foods, but one of the recipes that you would talk about is getting mango with a little bit of ginger, maybe a little honey, blending it, putting it in an ice cube, making them frozen, and then utilizing that frozen for mouth sores or just that sweet taste,
saliva stimulation, soothing that irritation, helping with that dryness. There are so many ways that you can utilize and create these little things like pureeing some of those low acid foods. It's a great way to get in some hydration. It can be really soothing. So there's lots of different ways that you can take this and get some ideas from places like the Cancer Fighting Kitchen cookbook as well.
Yeah. And then for the registered dietitian team and Erin's team, our philosophy is always a plant-forward, nutrient-dense plate, right? So when you think of your nutrient-dense foods, just think of your nuts and seeds and your fruit and your vegetables and how you add things onto those to combine them, like Erin was talking about, to give you the best bang for that bite, right? Because we know you might be just getting a couple bites in. So a lot of great recipes on our website as well, Erin, that they can go to.
Absolutely. Yep. And even think about, as you're sort of adjusting texture of food or methods of preparation, you can fit some of these nutrient dense foods just in by a little bit of cooking. I always say adding some of these foods to a soup and really cooking them down makes it much easier to chew, much softer on the mouth, but you're getting all of those beautiful nutrients and you're getting some hydration. You can even sip on a little bit of that broth. You can use that to sort of moisten some of those dry foods at mealtime. So you can really use a lot of these strategies in varying ways to help yourself. And I will say, there's lots of suggestions out there, and hopefully this gave you some tips to think about. We know that not everything works for everyone. Hopefully you will find one or two things that does work for you, that can at least soothe some of these side effects that you're feeling, even to some degree, to make mealtime and to make foods a little bit more palatable. So we know that it's not going to be 100%, but we want to do what we can to make it as easy as possible for you, to kind of make it as manageable, because especially when you're talking about the mouth and your throat and how that can be affected, it's such a challenge. It's such a challenge, and it can be such a turnoff to just have any food at all. And that's not what we want for you.
Yeah. So this episode will